Joining me right now, Dr. Lisa Stroman, a clinical psychologist and an advocate in mental wellness for kids. These are really strong statements. I mean, we've been talking for years about the impacts of social media on mental health, whether it's children or adults, and it seems as though now it's really reaching ahead. How should parents approach this? I mean, what kind of conversation should you have rather than just saying, no, you can't use social media? Should they sit down and say, listen, we're going to be different. We're going to be strong. We're going to grow and mature emotionally and intelligently. I mean, how do you start this kind of combo?
Thanks, Adrienne. I think that you must, as a parent, bring your kids in to understand the realities that these are intentionally designed to enslave this young population. We know now the Surgeon General is calling it out. We have public testimony. We have congressional hearings. The tech industry itself is going after our kids. And as parents, we can't, in one vein, ask our children to put a helmet on and to ride a bike or put a seatbelt on and then allow them to go onto these products that are intending to go into this vulnerable time in their developmental period and create self-doubt, hurt self-worth, and manage like anxiety, depression, suicide, self-harm without doing something. So we have to, in my opinion, go to our children and have those conversations honestly and openly as young as we possibly can.
Well, you use the term enslaved, that social media enslaves this young population, that the data suggests that structural parts of the brain are actually affected, the loss of gray matter and white matter, and that there is a morphing of the dopamine reward pathway. So people actually, it's like young people are getting addicted to the dopamine high in reading posts and sharing posts. But you say, or at least some of the research is saying, that girls are affected more than boys. Why?
Absolutely. I think that a lot of the platforms tend to be going into this vulnerability of where we are in the world. So if you think about the developmental stages of elementary school kids, they're trying to identify, am I good? That's kind of the basic Ericksonian developmental stage. And if you have a child at that age that is going on and getting a post or getting ignored on a post, or they're not getting invited into things, they really start to get a massive amount of data that they aren't good enough. And then if you move into the teenage years where you're trying to figure out who am I, and you have to bring in more and more data, girls tend to look at more of the video-based, photo-based. And so they're going out there and saying, am I worth anything? Am I somebody that matters in this world? And if they're not getting any feedback, they tend to go into these negative cycles, as well as having a product that's designed to put them in this algorithmic misstep to allow them to feel less and less confident so that they go on more and more. It's just a terrible design. The industry knows that they're doing it intentionally, and the girls, unfortunately, have a much higher rate of self-harm, suicidal ideation, and ending up in the emergency rooms more than boys.
It's just staggering. And I know that the U.S. Surgeon General suggests that parents actually band together and just have a group meeting, so to speak, or a neighborhood meeting, and says, okay, we're all going to keep our kids off social media until 17 years old or 18 years old. But if parents already see that their kids are hooked on social media, what can they do about it? Is there anything that they can do to kind of reverse course?
Absolutely. I think the Surgeon General's comment was a bit unrealistic, if not wildly unrealistic. I mean, he's calling out the tech industry as being this billion-dollar industry, and then he's asking parents one by one to try to fight this with their children. If your kids are already on, I think that you have to go through very, very intentionally and look at your own use. Are you being the model for these children? Are you giving them an example? If you're texting and driving, your children are going to. If you're on social media, they're going to want to be. So you've got to really take a step back as parents and say, all right, this is really important. We are damaging these children. They are becoming mentally in crisis. How do we figure this out? And as parents, I think that we have to be the stewards in that. And we should probably look to ourselves. We look to our congressional leaders, like we have to be advocates, because the industry themselves are not going to be doing it.
Well, it's going to be very difficult for the industry to change it if kids can get online and lie about their age and just surf anyway, which is what they do now. It might be a little more realistic to have a group of people and do it as a tribe and say, you know what, let's do this together because we're going to support each other. Dr. Lisa, thank you so much for being with us.
Thank you for having me.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.